So we are looking at market failures in healthcare. Market failure in healthcare occurs when free market system is unable to allocate resources efficiently, resulting into failure to provide optimal level of health care services. Okay, so that means that um, the services are made extremely expensive, or the services are actually not available. Okay, so you have a cost issue that results into healthcare services not being um, at the optimal level. So the causes of market failure are information asymmetry, externalities, public goods, and market power. So we are going to look at each of these and see how they contribute to market failures. Okay. Okay, so we start with market asymmetry, which is that uh, the information that one party has in the market is more than the information that the other party has. Okay, so here the healthcare provider, who can be a physician, a dentist, a general doctor, a nurse practitioner, these providers are having more information about what the patient is suffering from. Okay, and the patient or client has little information. Okay, so there is asymmetry. So the information is not, the information that the other party has is less than what the physician or the healthcare providers actually have. So that means that the physician have more information about the costs and benefits of particular treatments, whether they're drugs, whether they're procedures, whether they're surgical procedures. The physicians have more information about these procedures than the client. Okay, so this means that the physician or the healthcare provider can charge more than usual, more than what can usually be charged, because the patient doesn't know. Okay, so if we have that situation, that means resources will not be allocated efficiently. So what will actually happen? My slides are moving slowly and then faster, having issues. So that means that the clients can be charged higher than what they would actually negotiate for if they had all the information. Okay, so eventually you will have even a client receiving sometimes unnecessary and ineffective treatments just because they don't know about these treatments. Okay, and then the physician will have that incentive to provide more and more treatments such that they get more profits. Okay, so that's the impact of information asymmetry. And then the other point is what we call externalities, which we said that externalities are effects that are experienced by a third party, okay, as a result of a transaction that they have not been part of. Okay, so you have a third party experiencing the costs and benefits of a transaction. Okay, a third party is that person who is not part of that transaction, but they are affected by it. So that is what we call externality. So in healthcare, um, you have things that impact your life, whether you you have been part of that event or not. So an example could be that a person contracts an infectious disease, and then you get a lockdown like the one we had during COVID-19. Okay, someone else gets the disease, but as a result of that disease, there is a lockdown. So that impact is what we call an externality. You have not part of the event that happened in someone getting the infectious disease, but you are now affected by it. And the example of COVID-19 is actually very important because the first cases of COVID-19 were reported in China, but all countries are had to face the negative impact of COVID-19. So that is a perfect example of one externality. So the externality can be negative or positive. Okay, so not all externalities are actually negative. So an example of a positive externality is when you have a community vaccination campaign where most of the people have been vaccinated. Those that have not been vaccinated will benefit because there is going to be what we call herd immunity. Herd immunity is going to be experienced in that community. So even those that are not vaccinated will benefit from the fact that most of the members in a community have been vaccinated. So that's a positive externality. A negative externality is that, of course, you get harmed. It is either a harm or a cost. It's negative. A cost or a harm to others as a result of actions of another party. Okay? So a negative externality can be when you have a healthcare facility or a pharmaceutical company that pollutes the environment. The people living nearby will be affected by this pollution, yet they are not actually part of the team that are working in the healthcare facility or in the pharmaceutical company. So that's a negative externality. So we move to the role of government or even other key stakeholders in health in addressing externalities. Okay, if you understand externalities, then it is very possible that you create a healthcare system that is efficient and effective, where the individuals and the society actually benefit as a whole. Okay, so that means that for every policy decision that is supposed to be made, we must always look at the externalities that can always happen. Okay, you maximize the positive externalities and minimize the negative externalities. Although this is actually only limited to citizens of the German Reich. The fourth factor was what we call the public goods. When we talk about the public goods, we are referring to the non-excludable and non-rivalrous goods. Okay, I will explain those two terms. The non-excludable goods, if we talk about that, it means that you cannot withdraw that good from a person using it. For example, the road. If you construct a road, you will not say, if you are of this tribe, you not use it. No, you cannot exclude someone from it, okay, from using it. Okay, so that is an example. And then the non-rivalrous goods means that even when I use the public good, it doesn't mean that another person who comes and uses it will find less of it. If I move on the road, it doesn't mean that I will consume the road. So the person who comes after me will not find the road. No, that will not happen. So those are the characteristics of public goods. Okay? So healthcare services can be termed as public goods. Okay? So vaccinations, disease control, all these are actually public goods and they benefit all members of society. So that means that they are not private goods. Health can be looked at as a public good but not as a private good. The way we look at health is what determines what we do. If the government looks at health as a public good, it means that it is going to provide healthcare services because public goods are provided by the government. So it is going to invest in making sure that services are majorly provided by it. But if the government looks at health as a private good, then it means that it will not really bother so much in controlling the healthcare sector. It will allow the forces of demand and supply to work out. So it will not really intervene. Okay?
Years in the same regiment, with only short breaks, and took part in nearly all the battles. Prince Peter, second.
So what is the impact? What does it mean? If we look at health as a public good, it means that the prices or the costs of healthcare services may not really follow that pattern of a perfect competition. Okay, so the prices will not be the actual reflection in the marketplace. Okay, so that means that you will have some services that are not provided by the private sector, but now that is where you need the government to really come in and ensure that these services are provided. Okay, so for example, the vaccinations. Okay, you'll find out that few private entities, private health facilities are actually engaged in vaccinations, especially for the immunization schedules for children. Okay, because they may not really get a lot of money from it, and therefore the government usually comes in and provides the vaccines to these private facilities for free, such that even if it is a private hospital, immunizations can take place using the vaccines that are provided by the government. Okay, so the provision of public goods in healthcare can be difficult in a market system, and the cost of providing the services may not really be reflected in the market price. So in that example where you have private facilities immunizing children using vaccines provided by the government, they may charge something that is actually very, very little to actually products. And then the last point is about market power. And market power is the ability of a given firm to control the prices and exclude competition or behave independently of its competitors, consumers, and suppliers. So if you have very big companies that are controlling majority of the market share, then they will have what we call significant market power. Okay, so they're the ones that are actually controlling the system. So you don't want to have such a situation because they will maximize profits and they may not provide higher quality services.
In a letter.
Okay, so market powers allow providers to charge higher prices than the marginal cost of production, leading to allocative inefficiency and deadweight space. We shall look at those curves in our subsequent lectures. What dead space means and what allocative inefficiency means. And then market powers also reduces consumer surplus and increases producer surplus, creating distributional problem that may harm social welfare and inequity. If you have very few firms controlling much of the market, you will have difficulties in entering the market. So entry into the market becomes very difficult. This reduces competition, of course, but also reduces innovation and eventually the quality of healthcare services also. And will also result into more asymmetry, information asymmetry that can happen between the providers and the consumers. So basically, you need the government to intervene in market failures, okay, to address some of these market failures. Will always happen, even if it is a competitive market. You will have market failures. So the government needs to come in to address these market failures. So what do they do? The government can introduce what we call subsidies. Okay, so for example, the example I gave for vaccines, the government providing vaccines to uh, private facilities. That is a kind of subsidy. Such that the children can be brought to these private facilities and can be vaccinated, but at a lower cost, because the private facility is not actually incurring costs of buying the vaccines. And then the government can also introduce taxes to discourage harmful behaviors. Okay, this is basically to minimize externalities. Okay, for you, you are not smoking, and then you have other people who are smoking, and when they smoke, they get this lung cancer, and then the lung cancer becomes expensive to treat for the government. So the expenditure increases. So that means that the health expenditure on treatment of people with lung cancer increases, and this negatively affects people who are not actually smoking, because much of the money is going the other side, yet for me, I actually don't smoke. So it means if the money goes the other side, I'm actually going to bear my own costs. Okay? So it creates issues to do with resource distribution. Okay? And then also, people who are smoking, they also have an effect to people who are non-smokers, passive smoking, or what you can call secondary smoking. Okay, so I'm not smoking, but another person is smoking next to me, who is smoking next to me, I get the impact of that smoke, and therefore I can have health issues resulting from behaviors of another person, for example. So that means that for these externalities not to happen, the government needs to make sure that people don't smoke. Okay, So by introducing taxes on things like the cigarettes, it means that it is discouraging people from smoking. So cigarettes, alcohol, all those things. And then regulations. The government can introduce regulations to ensure quality, safety, and ethical practice. Okay, so for example, the introduction of drugs into the country, you need to follow the relevant rules and regulations in order to get the drug into the country and register it. Okay, so these practices ensure that the citizens do not get substandard drugs. And then public provision. The government deciding to provide services directly through its public healthcare system or health system. Okay, so that's where you have primary healthcare centers, primary healthcare units, county hospitals, and then state hospitals and the national referral hospital. If the government does not provide these services through these hospitals, then you have the private people charging highly, okay, and that brings issues. So we have looked at the fact that market failures happen when resources are not allocated efficiently. And this can happen because of information asymmetry, because of market power. Excuse me. Yeah, so with that, the government needs to actually come into play to address some of those